Welcome to ASA Central Line, the official podcast series of the American Society of Anesthesiologists, edited by Dr. Adam Stryker.
Hello, and welcome to Central Line. I'm Dr. Keya Locke, your host. Dr. Sam Page is with me today. Dr. Page is our guest editor of the October ASA Monitor, which delves into the topic of advocacy. He is so graciously going to share his expertise with us today, so I'm pleased to welcome him back to the show. Dr. Page, you've been a guest on Central Line in the past, but can you give our listeners a quick reminder of your advocacy-related experience and roles?
Yes, and thanks for letting me join you today. I've been involved in advocacy really since residency. Currently, I'm chair of the ASA Committee on Governmental Affairs, which I've done for the past 5 years. I've been on this committee off and on for about 20, and I've held several elected positions back in Missouri. I'm currently St. Louis County executive, but I served in the state legislature and on the city council in my suburb. So I've had a lot of opportunities to interact with elected officials.
Excellent. I want to start today by inviting you to share your thoughts on what is possible. Sometimes it feels like protecting patient safety, defending the specialty are really lofty goals, and it's hard to visualize as individuals what we can do to make a difference, which of course is what advocacy is all about. So why would you say it's important for anesthesiologists to get involved in politics and advocacy efforts?
Well, you don't have to spend a lot of time in the operating room to start to see how decisions made by others in state or federal government impact our ability to take care of our patients. Everything from drug shortages to regulatory issues around IV access to reimbursement for taking care of our patients and being able to provide them the services that they need. So just about everything we do in medicine these days is regulated, and it's very important that we're in the conversation about what the right decisions are so that we can take good care of our patients.
Yes, I definitely agree. I mean, it's important, and I'm sure you would agree that for us to understand that we can still make a big impact, as you said, with minimal, time investment. Doesn't take that much time to still be involved. So thank you for sharing that. And more globally speaking, what would you say is at stake here? What are the key issues the anesthesiology community is advocating for? And if you could talk about threats and opportunities that are coming our way.
Well, the opportunities really surround engagement in the entire surgical experience, preparation for surgery and post-operative recovery. The opportunity for us to engage in decisions around testing and treatment post-operatively and in the recovery period, to engage in tightening up best practices in the operating room decisions we're making. All of these can lead to better quality of care. It can lead to lowering costs, which increases the value of our services and impacts the questions around reimbursement and the quality of care patients receive. That's a conversation we should be in as anesthesiologists. And there's a lot of opportunities every day developing around that question, access to new data and new discoveries that come out of our academic institutions every day. The threats are really around patient safety, around surprise billing. Our patients, for a long time, were dealing with bills that they did not expect. It's really a question of surprise lack of insurance coverage or what they thought was a routine experience. We've navigated that with federal legislation, but unfortunately, the implementation of that legislation through government regulations has been broken. And we're working to change that to make it more fair to the patients and to the doctors taking care of them. We're also very worried about the quality of care in VA hospitals. And there are proposals now in front of the Veterans Administration to remove anesthesiologists from the anesthesia team in VA hospitals, a standard of care that you wouldn't find in any of the major health systems or hospitals across the country that take care of complicated cases on a regular basis. And we know that our veterans can sometimes very, very sick and complicated patients. There's lots of issues at the state level that come up in the state legislature, issues around title, who can call themselves a doctor or an anesthesiologist or a resident. and the confusion that causes in a patient care setting, the confusion it causes in the operating room in the intensive care unit. We think it's very important for patients to know the education and training of the people taking care of them. And we think it's important that an anesthesiologist is involved in every anesthetic. And there are lots of state and federal issues around that.
I know even when I was still a resident, there was talk and their conversation about scope of practice and things that you've just spoken about. Would you say that that's an ongoing battle? It seems like, would you say that that's something that we will continue to have to battle into the future? Or any thoughts on where we are with that in general?
Well, I don't think that ever goes away. Every specialty of medicine faces questions around what's the role of a doctor on the patient care team? What's the role of other providers who play a very important part of taking care of our patients, physician assistants and nurse practitioners and registered nurses and patient care assistants and technicians. They all have important roles in the hospital and in the operating room. But we know that the team needs to be led by a physician anesthesiologist, and we want to make sure that that standard is applied everywhere in the country and in every anesthetic. And that's a conversation that I think is going to continue as we struggle with more people who need surgery, less providers of anesthesia services available. That's the question is, and that pressure is always going to be there.
Yeah, thank you for that. It sounds like, it's a ongoing involvement on our part that's going to be needed even for the next group of folks coming up even after me. So what would you say success looks like, with all of our efforts? Can you talk a little bit about the results of ASA's advocacy efforts, both on the federal and state level?
Well, I think success looks like holding our standard of care in the veterans hospitals to make sure that all of our veterans have access to a physician anesthesiologist when they need surgical care. Success would be repairing the surprise billing legislation that is broken in its regulatory application. We probably will need to be new legislation to fix that. Success would be allowing anesthesiologists to practice at critical access hospitals in rural America. As it stands today, anesthesiologists are locked out by a unique quirk in the reimbursement models for these hospitals in rural areas that don't have a lot of volume in their case mix. And we're working very hard to address that issue. Something that we've identified as a priority because AAs are an important part of the anesthesia care team and work under the medical direction of an anesthesiologist in health centers all over the United States, and certainly are involved in even the most complex cases in just about every type of anesthetic. We had a couple of big wins in the past year in Utah and again in Nevada, where licensing was passed and advanced in a way that allows anesthesiology assistants to expand their practice in these states. And that's important for the folks who have been working on that a long time. There are anesthesiologist assistants who were born and raised in Utah and Nevada, but haven't been able to work there and will now be able to go home and practice in the place where they grew up near their families. And brings a new type of anesthesia provider to the state and helps take care of some of the workforce shortage issues that they're facing. In Utah, for example, I know they worked on that bill for 10 years, and that was an ongoing conversation. It took a long time to get that through the legislature, a lot of advocacy efforts by the anesthesiologists in Utah and by their state component society. And it doesn't always take 10 years, but it almost always takes a long time. It's rare that you can have a bill sponsored and have it pass in one legislative session. And that's why the continuous advocacy is so important. There are independent practice bills in 15 or 20 states every year. And some states have had a CRNA independent practice bill every year for 20 years. And the anesthesiologists in those states work hard to explain the difference in education and training of anesthesiologists and nurse anesthetists. And they work hard to make sure that the elected officials making these decisions in licensing understand the importance of having an anesthesiologist lead the anesthesia care team. I think from the bigger picture, success is embedding advocacy education and the expectation of advocacy in the practice of every anesthesiologist. In residency, we're doing that now. We have our Advocacy Champion program that Dr. Tony Conte from California has developed. And there's more information available on the ASA website. Participating in the legislative conference in May, we'll talk more about that later. That's important. But I think we have all of these things we have to do on these individual goals and issues that we're working on. But really, success is every anesthesiologist knowing their elected officials, being comfortable with spending a little bit of their time communicating policy questions. And then a subset of active anesthesiologists will take it even farther than that. They'll run for office. They will participate in the legislative conference. They'll have greater participation. But success isn't just the issue of the day. It's also embedding advocacy in our scope of practice and our expectation of a practicing anesthesiologist.
Thank you so much for that. I mean, from what I've come to understand about advocacy is that it is certainly a marathon rather than, sort of a sprint. So what advice would you give to our listeners who are looking to get more involved, but may just be overwhelmed with trying to find a good starting place, specifically when you talk about getting involved in politics or supporting certain candidates, or even as you mentioned earlier, becoming candidates themselves? Could you paint a picture for us of what some of the possibilities are and how we can go about engaging more effectively, even with our local community?
Well, there are lots of ways to engage the political process. The initial opportunity would be to respond to an ASA alert, to communicate with your elected officials about a particular issue, to send an email or call your member of Congress or your state legislator. A more advanced opportunity would be to just have a meeting. Call up these folks and say you want to have a meeting with an elected official or a member of their staff to talk about an issue that's important to you, and they will meet with you. They will meet with physicians from their district, or a member of their staff will whenever asked. It's a good experience to understand how to communicate with elected officials, and they certainly want to hear from you. It's easier to communicate with an elected official and get in to see them if they've met you before they were elected. And that's why it's so important to pay attention to who's running for office, to look at their websites, to talk to your peers, talk to our state and federal lobbyists, and find out who has a track record of supporting issues that are important to us, issues of patient safety and the things that we've been talking about. And get involved in those campaigns. Go meet the candidate, find one that you like, put out some yard signs for them, and let them know that you're supporting them because of their record.
Thank you again for that. And I think, as you mentioned so eloquently, it's really important to get involved early and to stay involved for the duration. We know that ASA has recently launched a new resident advocacy champion program. Can you talk about the role anesthesiology residents play in advocacy and tell our listeners why it's so important to get involved?
Well, part of the scope of practice of anesthesiologists is to engage your elected officials. And if that's not something that you're comfortable with yourself, then you'll want to appreciate your colleagues who are doing that and make arrangements for them to have a flexible schedule so they can do that. It's important to get involved as a resident as you're starting to learn the nuances of anesthesiology. It becomes obvious pretty quickly where state and federal regulation and law will impact your ability to take care of your patients. And you're really well positioned to have these conversations with elected officials and their staff. And they're certainly interested in hearing from young physicians who are starting out in practice, who are going to be practicing in their community for 30 years. They want to know what's important to you. And making that investment in time early in your career makes it a lot less frustrating to try and navigate the practice of anesthesiology. If you have the tools to engage your elected officials and impact the decisions that they're making.
Thank you so much. I'll just add that, resident involvement, especially when they you get your boots wet, as you mentioned early, just really helps build those relationships again early on and gets you really comfortable, because it can be uncomfortable talking to politicians. I know I kind of got involved in the legislative conference as a CA3, And, you may even find for our people who are just starting out that you're quiet for most of those meetings. But I think just getting your boots wet and feet on the ground and in the practice of engaging really early just helps ensure that you'll stay engaged throughout the course of your career. And I know you're going to talk to us a little bit about the legislative conference, which was recently held. And for our listeners who haven't attended this conference, can you tell us why it's important and what happens in DC during those really sort of action-packed days?
Well, the ASA Legislative Conference is really one of the biggest anesthesiology meetings of the year. It's held in Washington, D.C. every May, Monday through Wednesday. And we spend the first day and a half getting an update on the key issues that are before Congress at that particular year. And we hear from members of Congress and members of the administration who hold key leadership positions. We hear from them about the issues, their perspective, and what they see and what direction they think things are going. It's a great way to be caught up on what's happening. It's a great way to hear it directly from the decision makers. And then once armed with this information, we schedule visits with our members of Congress and their staff. Tuesday and Wednesday, we get around to see our elected officials and we tell them our concerns. We relay personal stories about how these decisions that they're making impact our ability to care for our patients and the health of their community. It's really a very rewarding experience to be armed with the information to allow you to communicate effectively with members of Congress. And we really do change the decisions that are being made by being present and being in that conversation. And it really makes it much more effective for our lobbyists to follow up and visit with our elected officials after they've heard from someone in their district, a real physician who is taking care of their constituents. It's a very rewarding experience. We always get high marks from the attendees, and it's always a really good crowd.
Yes, and as you mentioned, it is one of the largest meetings that ASA holds, but it's for our listeners, it's not as big as the ASA meeting. So I think for residents and younger faculty kind of just getting involved in the advocacy process, it's a great place to sort of start and get your feet wet. Would you agree with that, Dr. Page?
Yeah, it's a good experience as a resident or a young physician to visit with a member of Congress, with someone, an anesthesiologist who got a little bit more experience, who's had these conversations over the years. It's like taking care of a patient in the operating room. You see a few cases before you're out on your own, doing this with some supervision and guidance. And the first time you go see an elected official, you're going to be with somebody who's done this before, knows how to get their point across, and you'll be watching and learning.
Wonderful. So what can you share with us about the October issue of the Monitor, and sort of what do you hope our readers will take away from that? And is there anything specific in the issue that you took away from editing?
Well, there's a recap of the ASA Legislative Conference in May. So we'll talk about some of the highlights of who was there, who spoke to us, and what we learned. And then there are articles that identify some of the key advocacy activities over the past year. Dr. Mike Beck from Utah will talk about his success in the AA licensing bill, the importance of relationships with elected officials, the title misappropriation bill that moved through Utah, and the advocacy work of anesthesiologists to get that bill passed. Dr. Alex Choi and I have an article about running for office. If you are thinking about running for office, we have some pointers, but more importantly, offers some ability to follow up. We've developed a work group to mentor candidates for office, anesthesiologists who are thinking about sometime becoming a candidate for office. We want you to be successful, and we have a bipartisan support to help you do that. John Scott has an interesting article there about how to hold a fundraiser in your home to help an elected official. Having a fundraiser in your home is a great way to help someone who agrees with you be successful in their campaign. It's a great way to build relationships with decision makers. And Dr. Tony Conte has an article there about his Resident Advocacy Champion program. And it's a really cool program that recognizes residents who research an issue, become familiar with it, and then meet with an elected official and then report back. from that meeting, it's a great way to get started in learning how to communicate with decision makers at a very early point in your career.
Thank you so much, Dr. Page, for your time and expertise. I think this has been a great conversation. And to our listeners, thanks so much for tuning in and for your likes, shares, and feedback. You can always learn more about this topic at asamonitor.org, and please join us for more Central Line soon.
Thank you. Thanks for having me on.
Be part of the solution. Connect with legislators about important issues facing the specialty. Join the ASA Grassroots Network at asahq.org/grassroots. Subscribe to Central Line today, wherever you get your podcasts, or visit asahq.org/podcasts for more.